The morning was like a typical morning. I came down here probably sometime around 5:30 in the morning. Terry came down around 7 o'clock in the morning and said, would you like a cup of coffee? Older grandson, who was 7 at the time, came downstairs as well. He was upstairs sleeping with our grandson and our granddaughter. I looked at Terry, she just didn't seem right. I asked if she was okay. She said no, she was fine. She brought the coffee out to the back room and she mentioned that she was experiencing a little bit of a pain kind of in her chest area. I went and got her a cup of ice water, brought it back to her. And I said, Terry, you're perspiring. I think I really have to call 911. And she said, well, give me pajamas and slippers. And she sat up to get dressed, and that's when she had kind of the event, the cardiac arrest.
The call comes in basically stating that a woman has had cardiac arrest at home, that the paramedics arrived in a timely manner, that there was bystander CPR, that it was effective CPR, but that she wasn't able to be resuscitated and have a sustained pulse. Once she is resuscitated to the point where she can have a pulse, then our job is to take care of the underlying problem, which in this case is a blocked artery. As we're taking care of that blocked artery, this is where we note that she doesn't have enough blood pressure to support herself, so medications are initiated. And at that point, yes, she is in cardiogenic shock, and that's where the treatment paths are still being developed.
I understood from everybody that had spoken to me, and that Terry at that point in time was pretty fragile, that time was critical at that point, so I was scared to death.
We did find a blocked artery. It was the left anterior descending artery, which is one of the largest arteries in the heart, supplies about close to 2/3 of the heart muscle. It took us about 15 minutes to identify the blockage and fix the blockage.
It was made clear to me the next 24 to 48 hours would be critically important in terms of Terry's progress.
In the first few hours to the first 24 hours, we need to have very close monitoring of the patient because her trajectory is going to change very quickly. It's like going on a roller coaster ride. She could have a very smooth ride, or it could start to get very choppy very quickly, and that's where the monitoring comes into play.
Over the course of the night into the morning, I was concerned that she wasn't getting better.
She couldn't maintain her blood pressure with 1 drug, then 2 drugs, and finally 3 drugs were being added. And with every drug that gets added, her likelihood of dying goes up significantly. This was one of the first opportunities for Brockton to use a new technology called an Impella heart pump. We placed the Impella heart pump in Terry. The heart pump is designed to minimally invasively support her heart function and get better blood flow to her body. And so it was at that point that we initiated a transfer emergently to go into Boston to Tufts Medical Center. And at Tufts in the catheterization laboratory, we reassessed how she's doing, saw that she was still not completely stabilized with the use of an Impella. And so we added and escalated her care to add the addition of extracorporeal membrane oxygenation, or ECMO, in combination with the Impella technology. And once that occurred, then we had more control, she had more stability at that point, and we could continue her care.
I couldn't stand up. I couldn't walk. So that was frightening.
What I always tell families is that when you arrive, and if you're able to survive that first 24 hours, from there we start a marathon. This is not a sprint.
And they were very open and transparent in terms of kind of where Terry was. And then they allow you to participate in the rounding every morning. And it'd be a nice discussion and dialogue about the things that they were going to be doing that day.
To be able to witness how committed individuals were to helping her get better, even when she had bumps in the roads and some serious complications, realizing that, we are all there.
I just can't express how grateful I am for the staff, everyone. They made you feel human. They made my family, my kids, feel very welcome. They made you feel like you were part of their family.
She's a gold standard. I think that there's no doubt. Terry threaded the needle. She threaded many needles. Many patients can't thread the needle. And this is not something that we should leave to chance. This is something that has to be developed as a global algorithm that can be used here in the United States, but also around the world.